Hello and welcome to our channel. Today, we're continuing our ECG interpretation series with our second video specifically designed for NCLEX-RN. ECG interpretation is an extremely important topic in the NCLEX examination. As a nurse, being able to accurately interpret ECG readings is crucial in providing proper patient care. In this video, we'll be covering questions, answers, and strategies for solving ECG interpretation questions. We'll also be explaining the reasoning behind each correct and incorrect option, so you can fully understand the material and feel confident in your ability to ace the NCLEX. At any point you find yourself feeling confused or unsure, I invite you to take advantage of our free NCLEX-RN Fast Track practice course. The link to this course is available in the description below, and you'll be well on your way to successfully passing the NCLEX-RN exam. So, be sure to like, share, and subscribe to our channel, and let's get started. A 35-year-old male patient is brought to the emergency room with symptoms of heart palpitations and chest pain. After conducting an electrocardiogram, the results show that the patient has sinus tachycardia. What is the most appropriate management for this patient's sinus tachycardia? A. Administer atropine. B. Administer beta blockers. C. Administer a calcium channel blocker. D. Administer adenosine. The right answer is B. Administer beta blockers. A. Atropine is used to increase heart rate in patients with sinus bradycardia. It is not indicated for sinus tachycardia. B. Beta blockers is the most appropriate management for sinus tachycardia as it reduces the heart rate by blocking the effects of the sympathetic nervous system. C. Calcium channel blockers may be used for sinus tachycardia, but beta blockers is considered the first-line treatment. D. Adenosine is used for the management of supraventricular tachycardia and not for sinus tachycardia. A 65-year-old male patient presents with a heart rate of 55 beats per minute. The ECG shows a normal P wave, normal QRS complex, normal PR interval, and a regular rhythm. The patient has no history of heart disease and is considered healthy. What type of heart rhythm does the patient have, and what is the appropriate management for this type of rhythm? A. Sinus bradycardia with the appropriate management being atropine sulfate. B. Sinus tachycardia with the appropriate management being beta blockers. C. Atrial flutter with the appropriate management being sodium channel blockers. D. Ventricular fibrillation with the appropriate management being defibrillation. The correct answer is A. Sinus bradycardia with the appropriate management being atropine sulfate. The patient has a heart rate of 55 beats per minute, which falls within the normal range for sinus bradycardia. Atropine sulfate is the appropriate management for stable sinus bradycardia as it increases heart rate. Options B, C, and D are not appropriate as the patient does not have sinus tachycardia, atrial flutter, or ventricular fibrillation. A 35-year-old patient presents with an irregular heart rate. Upon evaluation, the patient's ECG shows a lack of P waves and a chaotic rhythm. What is the likely diagnosis for this patient based on their ECG findings? A. Sinus bradycardia. B. Atrial fibrillation. C. Supraventricular tachycardia. D. Ventricular fibrillation. The correct option is B, atrial fibrillation. The patient's ECG shows a chaotic rhythm with no identifiable P waves, which is indicative of atrial fibrillation. In atrial fibrillation, the SA node fails to pace the heart and impulses are coming from the AV node, resulting in abnormal P waves and a chaotic rhythm. Option A is incorrect as sinus bradycardia presents with a regular rhythm and a heart rate less than 60 beats p.m. Option C is incorrect as supraventricular tachycardia presents with a regular rhythm and a heart rate greater than 120 beat/m. Option D is incorrect as ventricular fibrillation presents with no pulse or QRS and a chaotic rhythm, while the patient's ECG shows a chaotic rhythm but with a normal QRS. A 60-year-old patient with a history of heart disease was admitted to the hospital with complaints of a slow heartbeat and weakness. Upon examination, the ECG showed a sinus rhythm with a rate of 50. What is the most appropriate management for this patient? A. Cardioversion, B. Atropine sulfate, C. Sodium channel blockers, D. Pacemaker implantation. Right answer is B. Atropine sulfate. A. Cardioversion is an inappropriate management option as the patient has a slow heartbeat but not a cardiac arrest. B. Atropine sulfate is the appropriate management for the patient as he has sinus bradycardia and atropine sulfate will increase the heart rate. C. Sodium channel blockers is an inappropriate option as the patient has a slow heartbeat and not a fast heartbeat. D. Pacemaker implantation could be management if atropine does not effectively increase the heart rate, but this should be done only after trying atropine sulfate first.